Our next presentation for the board is our health committee update, as is tradition. And so Dr. Tigan's going to come forward. I see that Robin Gilbert is here as well, joining her. And so they're here to provide an overview of all things health committee. Dr. Tigan.
Yes, good afternoon, Chairman Cooper, members of the board, and Dr. Cashwell. I am here to provide an update, and Ms. Gilbert is with me in case there's specific questions that she could answer after I finish here. Today's agenda includes the current transmission levels, so we'll look at those, and then we'll look at an update on the HCPS vaccination efforts, and review contact tracing, because we know there's been many questions about that. And so as we start with the transmission level, as we've been committed throughout the pandemic, our health committee regularly reviews and monitors the health data relevant to Henrico County and the impact it has on our schools. 2 weeks ago, I shared that the transmission levels in Henrico had reached the high transmission level. As of this past Monday, we remain at that high transmission level. Based on the 7-day data from August 15th to the 21st, the new cases per 100,000 was 214.9, and the percentage of PCR tests that were positive during that same 7-day period was 7.3%. 2 weeks ago, we did not discuss the level of school impact as we needed to set new baselines for September 2021. Given the increase in the number of students returning to in-person learning, we will be using the 2018-19 data as the baseline for student absenteeism and staff capacity. The approach will be to compare the data from week to week, so from 2018-19 to 2021-22. Transmission within school will be based on the number of cases and the resulting outbreaks, just like it was last year. The health committee will look at how many schools at each level, as the school level will drive the conversations between the Virginia Department of Health and School Health Services to determine the level of impact. It is the school level data that will drive decisions about classroom, grade level, or school closures. As we look at what are our efforts towards vaccination, what have they been and what are the results? Last week, we once again partnered with Virginia Department of Health and the Richmond Henrico Health District to provide a third vaccination clinic at Brooklyn Middle School, and it was on Wednesday, August 18th. This was to assist our families in addition to the COVID-19 vaccine, but also allowing our rising 7th graders to be able to receive their Tdap and meningococcal vaccines, and our rising 12th graders also were able to get the meningococcal vaccine. And both our rising 7th and 12th graders had an opportunity to receive the HPV vaccine as well, but that is not a required vaccine for school entry. The table on this slide shows the number of each vaccine administered. Overall, 288 vaccines were administered last week, and overall, 837 have been given across the 3 sites from June through August. In addition to these vaccination efforts, our school registrars continue to share the Richmond Henrico Health District schedule for immunization events with our families. In addition, the 4 vaccines provided at the school sites, other health immunizations can be obtained at these health department events. We know how important vaccination is in the prevention and spread of COVID-19 and continue to highly encourage all who are eligible and able to be vaccinated to get their vaccination without delay. As there continues to be questions about how full vaccination impacts quarantining, the Health Committee felt it was important to provide some clarification. Let's start by defining a close contact. If just one person is wearing a mask or neither person is wearing a mask, and they are at a distance of less than 6 feet for a total of 15 minutes or more within a 24-hour period, that would be considered a close contact, and that person would need to quarantine. The need to quarantine is based on the vaccination status of the person deemed to be the close contact. So if a person is fully vaccinated and they have close contact with a COVID positive person, they do not need to quarantine if they have no symptoms. However, they should wear a mask and get tested 3 to 5 days later. Please know that all cases are worked through contact tracing to verify vaccination status and symptoms. If a student is not fully vaccinated and they have close contact with a COVID positive person, they should quarantine for 14 days to be safe. Sorry, behind. So at this time, we're happy to answer any questions, and we hope that information helps our families with some of the questions they've been asking.
Thank you so much, Dr. Tigan. Ms. Kinsella.
Thank you. No, I really appreciate those last few slides specifically, because those are the things, you know, as we were talking about the, what does it look like when we go back in our buildings, you know, that our principals are going to be sending out to families soon. The last few slides, the close contact and the quarantining, everyone wants to know. So thank you for sharing that information publicly. At the last meeting, Ms. Gilbert said that we were going to hire 4 contact tracers and train them. How's that going? Have we found them yet?
We have hired 2, and we're still fielding applications for the 2 other positions.
Okay, perfect. Thank you. And then, will the COVID rates in individual schools be shared with families and staff this year, similar to the way it was last year?
We'll show the cases, but yes, we're continuing. We're starting a new ledger for the beginning of the school year,
okay,
but it will be the same process we used last year.
It'll be the same process, okay. And then I wasn't sure where to put this question, so I just put it here in health and safety. Are the students in middle and in high school responsible for cleaning their desks again this year? Is that part of our strategy? Yes.
It is, as far as, you know, as students come into a classroom, there'll be wipes available if they want to wipe down their desk, but also at the end of a class period, they'll be encouraged to wipe down the desk before they leave for the next person coming in. And so it's really about helping students feel comfortable, even if it's cleaning more often.
Okay, and then what do siblings, parents want to know, if you're in a house where you have siblings that actually get quarantined, what does it look like for the siblings? They just have to remain symptom-free and not come down, right?
Right, you know, it's a sibling would be not a contact of the infected person, and so they would not be required to quarantine, but family would want to watch for symptoms. Right. Ms. Gilbert, you want to add anything?
Ms. Kinsella, if
Yes.
there's a positive in the house, then the house would be considered a quarantine.
Okay, if there's a
Be a close
positive.
contact.
Positive
Now, we
in the
would work that relative to vaccination status.
Okay.
And if they were unvaccinated, whether they could quarantine and keep that positive case isolated in the house without continuing to expose the other family members to develop what amount of time they need to be out. The most amount of time an unvaccinated household exposure would be out would be 24 days.
Okay, we're going to have all these things out there again this year, right? And whatever.
Yes, ma'am. And
If this, then this, if this,
we're
then
happy
that.
to answer those questions. The nurses have all been trained
Okay.
on the Johns Hopkins contact tracing courses, and will be able to answer these questions at the school level. And we are going to do everything we can to minimize the amount of quarantine time any student or staff have to spend out of the building.
Okay, and thank you. That's all I have today.
Thank you, Ms. Kinsella. Ms. Shea?
I only have 4 questions. All right, here we go. So let's loop back with this. Since we're on contact tracing, let's just keep going with contact tracing. So we said if one person or neither person is masked, a close contact is within 6 feet for 15 minutes, et cetera. What if both people are masked? What is considered a close contact?
If both people are masked and closer than that 6 feet for 15 minutes or more, then you're going to look at the vaccinated versus unvaccinated status to determine whether they need to quarantine or not.
All right. So they are still a close contact even if both people are masked within
Yes.
6 feet. What if a student has, let's say, a runny nose one day? So they haven't had any confirmed, they haven't been contact traced, they don't have any confirmed exposure, but they happen to have a runny nose one day. Mom and dad keep them home just to watch. Are they out 10 days?
They are, unless they, for some reason they go to a doctor and there's a different diagnosis that says it's not, that it's confirmed to be something other than COVID from a physician, at which point when they're symptom-free with no fever-reducing medication and fever-free without that medication, they can come back to school.
So
it is dependent, and I know that Ms. Gilbert's ready to jump in, that the transmission rates too within the community. Remember, there's at different
Right.
levels.
So once we get down to, what is it, moderate, then it goes back to the regular 24 hours?
Yes.
And the nurses will work with families, so we know our children have a variety of medical conditions. If a child has a diagnosis of allergies, and this is something that we chronically see with that child, then the nurse is going to work with that child and that family to get them back in and to not keep them out. Same with reflux. I've got an upset stomach. Well, I have a history of reflux. Well, that's reflux, not a symptom of COVID. So we will work with the families. The nurses will make those assessments and look at the history to try and develop what that whole picture looks like, rather than just saying, oh, that's a symptom of COVID, you're out for 10 days.
Okay.
And if they do go out with a symptom, a new onset symptom, then a physician can write a note for them to return to school, and they come back based on what that physician says they should be back in school for.
All right, let me just, I know some families back in the spring expressed a challenge with that, a challenge with a physician definitively saying they don't have COVID because, they could have tested 2 days later and that physician doesn't know what they've done in the 2 days. So as we work with families, I think we just need to figure that out a little bit, that, you get what I'm saying, that so that we can really delineate and define students who may have had a symptom but aren't a COVID risk, so we can get them back to learning, right? Obviously, we want to be safe about it, but we don't want the same child being quarantined for 2 weeks at a time, every, be back in school 2 days. Oh, I have a cough, I'm out another 2 weeks, that sort of thing. So we need to be smart about it.
Yes, ma'am.
All right. While 90%, probably 95% of my constituents I talk to are thrilled we are wearing masks, there are a very few that still don't understand why the recommendation was made from you all for everyone to be masked. So can you summarize why that recommendation was made?
Right, at the Health Committee meeting, quite honestly, the conversation was looking at the community transmission levels as well as specific incidents that our schools were dealing with, whether it was health, sports teams. And so the decision was to wear masks so that we could protect that instructional environment as much as possible, reduce the risk of students exposing other students or being exposed and having quarantines happen. You know, as you stated, our kids need to get back to learning.
I know one piece that was emphasized in their last presentation around their recommendation for masks was absolutely the community transmission at the time, as well as the new CDC guidance. So there had been new CDC guidance issued related to masking that differed from previous guidance. So I think that was something that they took into consideration as well.
Are masks infallible?
What do you mean?
Are masks perfect? Are they gonna?
No.
No,
So-
there's nothing that's perfect.
And that's why we use layers of mitigation. And so we understand, you know, that the layers matter. And so it's the masks, it's the hand washing, it's all these things, not coming to work when you have a fever or sick or to school, all the things you've talked about, all of those strategies are layers that protect us and each other and prevent the spread of COVID-19.
So no one single mitigation is going to provide 100% of protection. It's all about each mitigation reducing risk. And when you layer them together, it's the best we have to offer.
Correct.
Yeah, okay. And then very last question, back in the spring, and maybe early summer, I know you were looking into partnering for voluntary testing for our stakeholders within our buildings. Where are we with that? Is that still a possibility? Is it, and I want to highlight, it's voluntary. Okay.
Correct. We have been working with the Glen Lee Community Learning Center and the telehealth clinic that will be there, working with those physicians from MCV to try to work out the protocols as to how best we can orchestrate that in that particular school, and then would use that as a learning environment should we want and be able to expand it to other schools.
Thank you so much. That's all I have.
Thank you, Ms. Shea. Mrs. Ogburn.
I'll be fairly quick. Obviously, we've all referred to a number of emails that we're getting, but we get a lot that have the same questions as sort of a theme going on, that parents are concerned. Some will say, I'm having great anxiety. Some will say, I'm really scared, whatever. Completely understand that emotion, and we all are doing what we can to protect kids. So this is sort of, I know it's a hard question, but how can we reassure parents that we're doing what we can do and that we're following the guidelines that we have? I mean, I know it's a level of trust that we expect people to have in our team and what we're doing, but I have been asked this a number of times. Do we have an FAQ anywhere? Where do people go that haven't read every email? I mean, because we have sent so much information out and they might have missed it. So where do we send people to get the questions answered and the most efficient way?
Can I go back to the first question about the
absolutely.
trust?
Yes,
Because
I'm wondering, I know,
I
but-
feel like I hope with our families we've built trust about the implementation and effectiveness of our mitigation plans
Absolutely.
through our spring, our summer. You know, as we go into the fall here, we had many schools, whether there were some even in the spring that were almost at full capacity as far as the number of students. This summer we had many students in our buildings, and you know, the fact that we did not have the number of cases that we're seeing other places, I think shows that our practices and how we implemented before even bringing kids back in the spring with our adults, I hope that provides some trust in our families that we have good practices and that we know how to implement them.
Well, and I don't think, honestly, we give that answer. often enough. We haven't referred to the last few months and how things have gone successfully in our schools. So it might be something as we answer those questions and as principals and other members of the team get that, we can look at the historical data that we have to show that what we're doing is working. Because as Mrs. Shea pointed out, it's not any one thing, it's the totality of what's being done by our staff. But to the FAQ, I mean, Mr. Jinks and his team send out so many emails, and they're so great at communication and getting the word out. Do we have an FAQ anywhere? Has this been considered?
There's what I refer to as the back to school page of the website.
Okay.
It's considered the lead item on the homepage of the website. It represents what has gone out in email to our families and has the added bonus of 5 translations on that page as well. The information is shared directly with our principals for them to cut and paste into additional messages that they do. But to your point, there is clearly an opportunity next week to once again ask for the audience's attention on all of this. And what Dr. Cashwell and I discuss frequently is how much can we ask of our audience when it comes to reading and absorbing and comprehending all of this material. There's little doubt, no doubt, of its critical importance. And so our task is to deliver it in a way that folks will find meaningful, relevant, in a way to understand that is not just there for them when the email crosses at some point next week, but is easily accessible in September, October, November, when they want to refer back to it. The short answer, Mrs. Ogburn, is that the information is available on our website in an FAQ form. It represents the previous versions that we've communicated to our families with an opportunity to re-up that information next week as we approach the first day of school.
That's awesome. And I think that's good for us to know as board members, that we can refer to that information and say, this is where you can find the answers to your questions. Because we, you know, to your point, we send things out, we can't make people read it. They might miss it. They might have been on, you know, at work, on vacation, whatever, this time of year. So I think it's important to note that it is there. We do put it on the website for any information that people can find it. And when in doubt, they email a board member, it seems. So, or you know, Dr. Cashwell or someone on the team. But I appreciate you pointing out where they can find what they need.
And to be fair, sometimes it is quicker to go directly to your board member. I can empathize with anyone who says there is simply a tonnage of information available on our website, and for good reason, because everything that appears on there is important to an audience of some kind.
But again,
and so asking for our audience's attention next week will be a key focus for us, and doing it in a way that will not feel as overwhelming to some folks, I would hope.
And your team has been so great about getting out the information that we need, and now they can access it in a very easy way. I appreciate that. All right, thank you. Appreciate that. I'm done.
Thank you, Ms. Ogburn. Mrs. Atkins.
Thank both of you for being here as always. I don't know how many times I can say thank you to both of you as well as the entire Health Committee, because we meet often, but maybe folks don't know in between those meetings we are still working. And so ever so grateful for the work. And getting prepared for back to school, can you share with families the required immunizations for enrollment?
I'm going to leave that to you by age.
So our kindergartners new this year had the hepatitis A vaccine, in addition to all the regularly required Tdap, polio, MMR, and varicella. Sorry, brain freeze for a second. So there's 5 right now, and they are on various schedules of when they need to be provided to the child. What I call the kindergarten surprise is the ultimate one when you go into kindergarten and you basically get everybody at one time. Hepatitis B is also on there. I didn't list that. So that's our kindergartners. We don't get another update of immunizations until we get into the rising 7th grade age. Some of our 6th graders get that HPV that Dr. Tigan spoke of. That is not a school entrance required vaccine. It is required by the state, just not to come into the school. But the Tdap to our rising 7th graders, as well as new this year, the meningococcal for our rising 7th graders, and also new this year is a meningococcal for our rising 12th graders. So Tdap in 7th grade, meningococcal in 7th grade, meningococcal in 12th grade, and everything that you get in kindergarten, which is a lot.
Fantastic. I know that, getting the inoculation for COVID is at top of mind, but we also have to remember that back to school encompasses other areas of our health. And that also needs to be at the forefront for many of our families. Is there a place on our website that lists the required immunizations for enrollment?
Mr. Jenks says yes. I know we have it on the immunization, the health history form, which is also located on the website, but specifically I would defer to.
Mr. Jenks, for families, could you just share where that stuff is located?
Speaking to the tonnage of information that we do have available online, which can be both positive and challenging at times, but the health and safety page of the website does have a tab called immunizations, and that's where the information is articulated.
Wonderful, thank you. The second question I have is, can you share the communication process between a parent and a nurse for a child who has a condition requiring medicine, or, for example, they have asthma, diabetes, or some other illness? Can we share that process with families, particularly those that are new to our county and those that just need the refresher?
So there are a couple of pathways there, Ms. Atkins. The first one is if your child needs a prescription medication. If that medication is going to last less than 10 days, we can take the prescription bottle and administer off of the prescription bottle with a parent signature. If it is an over-the-counter medication, there's a form again that the parent would fill out for us, giving us permission to administer the over-the-counter medication. That should come to the school in an unopened bottle or package. And we have to administer by the label, the prescribing label. So we can't give 15 Tylenol to your child if the label says we can only give one, based on age or weight. So that's the two medication forms. If we have physician orders that are more detailed for chronic conditions, tube feedings, nebulizers, you mentioned asthma. We have an asthma action plan. We also have a diabetic medical management plan, and we have a seizure action plan. So specific to some chronic disease processes, we have specific plans out there, and our partners in the community are very familiar with these, and your school nurse is ready to help if parents have any questions about that.
Thank you. That's something that several families have reached out. We talk a lot about getting shots for COVID, but can we start also talking about some of the traditional things around health and getting back to school? So I greatly appreciate the refresher and reminders to make sure that our parents are aware of those things. The other question I have is for students enrolled in Henrico Virtual Academy. Are they required to get those same immunizations since they're not in the building?
Yes, ma'am, they are. Even though they're not in the building, they're held to the same accountability. So our kindergartners need their physicals and need all those immunizations. If you're a rising 7th grader or a rising 12th grader, we're going to be looking for that meningococcal and reaching out to you. And in conjunction with this question and your last question, our school nurses are back in their clinics today. So parents, if you have questions, please reach out to your school nurses. They are in the schools and ready to answer those questions and help you with whatever your needs may be.
Thank you. I again will stress that COVID is certainly at top of mind, but there are some other things from a health perspective that we also need to pay attention to. And I have started getting questions around if my child isn't in the building, is that required for enrollment? And so to reiterate,
It is.
yes, 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 and yes. And another question I have, and Ms. Bolden, if you wouldn't mind coming to the microphone as I share the question, I would appreciate that. Thank you. Dr. Tigan and Ms. Gilbert, don't go far, because she may need backup with this particular question, so I don't want you to have to walk too much. But will students that experience long COVID symptoms require a medical note for excused absences?
Students?
I'm going to come to the staff one next.
Anytime our students have a chronic condition, which we would consider a COVID long hauler, it is most important for our parents to collaborate with their school nurse and their instructional team so we know how best to help them. So that partnership is really a four-legged process. We want to include the student, the family, our community physician, as well as your school team. And so anytime we can collaborate in that manner, the student always wins.
Okay, so you will need a note from the medical doctor for long COVID symptoms.
Need as in required.
Yes.
I don't want to say required, but again, that collaborative and communication process when a child is going to have trouble looking at a screen long-term, that may be a situation where we want to put in some accommodations, and we would at that point need that note. So again, that collaboration and that communication between those four pillars are just imperative.
So in essence, if a family is experiencing that, the first step is to contact the nurse and have that conversation. One of the questions in the way that it was received to me was, okay, I know this is a symptom. Do I need to take my child back to the doctor in order for them to continue school? And so I want to give you some context into where that question was coming from. So thank you for that. And so the other is the flip for staff. So for staff that have received a medical note for experiencing long COVID and now is offered or approved for disability under ADA, and end up missing work. What is the process so that their employment is not impacted negatively?
Okay, I know you want to clarify on.
You stay as well. Okay, so you used a lot of terms there, so if we could back up just a bit and just clarify for the public just what we're talking about.
Absolutely. So there are situations for individuals that have tested positive for COVID to continue experiencing some of those symptoms, also called long COVID. Also, if you're experiencing those symptoms in such a way that it does sometimes stop your ability to do things as you normally would, you may go to the doctor, and the doctor may medically diagnose you with long COVID, and then you can apply for disability under ADA. And so if we have staff that has that situation and end up missing work because of that, what is the process that they would use so that their employment isn't negatively impacted? In other words, they may miss work because of some of the symptoms that they're experiencing.
Right. The simple answer is for our employees to contact our HR specialist, Wendy Reyes, who deals with medical accommodations, requests for accommodations, leave, that type of thing. So again, that's Wendy Reyes in the Human Resource Department, and we can walk through and help folks through those processes.
I'm taking notes. One moment.
Yes, ma'am.
Is there a support system in place for staff that have tested positive and they're doing well now, but socially, emotionally need support? Can you share the support mechanisms we have in place for staff?
So again, not to put Wendy out there each and every time, but Wendy is our contact, and we work with individuals on a case-by-case basis to determine what their needs are and to route them appropriately to the appropriate resource.
Ms. Atkins, just to add here, we also have the EAP program available for our employees, which is a huge benefit and an awesome resource.
Right, that's definitely one of our resources. Thank you, Ms. Gilbert.
Thank you so much. To those who have asked me those questions that unfortunately, just like myself, at one point tested positive, and you are a long hauler or you experience some of those symptoms, please take advantage of the resources that we have right here in Henrico County Public Schools with the Employee Assistance Program, or EAP, as what Ms. Gilbert has shared. Also, Wendy, say that name again.
Wendy Reyes.
Gravis.
Reyes, Wendy Reyes.
Reyes. So Wendy Reyes is the individual that you can contact to get the support that you need. This is new for many. There's also more research about it. And so we're going to learn this thing together, but just know socially, emotionally, and physically, there are supports that are available to you, and you can use them right now. So thank you so much.
Thank you so much, Ms. Max. Mrs. Director of HR, don't walk off so fast. I'll start with you so you can stay right there. I hope your shoes are comfortable. So just a quick question. Thank you so much for clarifying the process in regards to the emergency leave, because I'm so grateful. Ms. Kinsella's kind of beat me, so I wish I could go when she went, but it was a big sense of consternation to a lot of people. Only question I have in regards to that, are part-time employees and temporary employees, are they eligible for that as well?
Yes, sir.
So it's full-time, part-time, and temporary?
Yes, sir.
Thank you, madam. You may go on back down the aisle. Dr. Tigan, quickly, just quick, I don't know if you can answer this question. Will any of our schools offer COVID testing on-site during the school year?
Right now, we do not offer COVID testing on site at any of our schools.
Okay, so we do not anticipate doing that during the year?
Well, we anticipate that at Glen Lee, because we have the telehealth, that would be something available for the students there.
As you stated, then we will look at the learnings, and then if
Yes.
necessary, we can make the application other places. Thank you for that
Absolutely,
clarity.
yes, sir.
All right, so if a staff member is not fully vaccinated, has close contact with a COVID positive person, quarantines for a few days, but gets tested and receives a negative result, must that student or staff member continue to quarantine for 14 days?
We have not required testing. The health department does provide opportunities there, but we have, because of equity issues and not knowing what the access is, that is not something that we've promoted out there for our families.
Just want to make sure that they can hear that answer to that question. Next one, does a COVID positive staff or student who is quarantined for the required number of days have to submit a negative test result in order to return to school?
No, they just need to be symptom-free and for 24 hours
Thank you,
after they've completed the quarantine
That's
period.
so important. Thank you.
And if
so
they've completed the symptoms before that, then they're good to go on day 14.
Well, thank you so
Come
much
back in
for
on day
that.
15.
Now, Mr. Jenks, what was the word he used? Was it tonnage? Oh, tonnage. Yeah, thank you for the word tonnage. You can sit right there, but the word tonnage has been a great word for me today. I want to just give you kudos. The HCPS Health Committee approved a mask guidance handout graphic that was created, was brilliant. And I say that because it's very straightforward, easy to understand, and it's easy to send out via email or on social media. The only question I raise is, thank you for creating that. Could we also have a similar guidance for quarantining protocols that answer some of the above mentioned questions that would be just as easily communicated via social media or an image? Is that possible?
We can certainly work on that.
I don't want to put too much, but I just want to say that handout was awesome. And as we have these nuanced questions in regards to quarantining, anything we can to make it a kind of a one-stop.
I think we can do a little flow chart that would make it understandable.
Thank you. That's all I have. Thank you.
Okay.
And thank you again for the marvelous work you all do.